Crying babies, little ones, are little bundles of joy. When they cry and cry and cry uncontrollably, and mom and dad have tried everything that we know to do to console them. We've changed the diaper, we've cuddled and rocked them, we've fed them, and yet they're still fussy. Ongoing crying and crying and crying. This is what we call colic. So good afternoon. My name is Dr. Angela Aberg, and I am a chiropractor who specializes in caring for little ones and pregnant moms. And so colic is a huge concern for parents, and it's something that if we just add a little information, we can really get an insight into what's going on in our kids. So welcome today to our colic webinar, and we're going to handle some topics and really get an idea of what's going on with colic and find out where we don't know a whole lot right now, and then where we do know a lot about what's going on and what we call colic. So colic, we use the term colic when baby's super fussy, maybe crying a lot. There may be a lot of gas. There may be some tummy distension in the baby, and we're just recognizing some discomfort in the baby. And baby is crying and crying and crying. So there is a pediatrician, Dr. Morris Wessel, who kind of identified and put a label, if you will, about how much crying constitutes colic. So in this one, it's kind of the rule of threes. So Dr. Morris Wessel, who is a pediatrician, said it is 3 hours a day of crying and 3 days a week, and that happens for over 3 weeks. When we have those 3 days crying, 3 days a week, or 3 hours crying, 3 days a week for 3 hours or more, then we can have that definition of colic. That's how we're defining colic. And Dr. Wessel, I did identify that maybe 20 to 25% of kids will get a label of colic at any one time. So that's quite a bit. That's 1/4 of our youngsters who are crying more than parents know what to do, more than we have answers for at any one time. And we're perceiving that baby's crying when all of baby's needs are met. So then the assumption is that something's not right with baby, and that's why they're crying, because that's their only message. That's the only way they can message us to tell us that something is not wrong in their little bodies. And to show their distress is in crying. And then as mom responds and dad responds and others respond, then sometimes baby can be consoled. But if they're not, then we assume that that problem is still left unsolved. And then that's why baby continues to cry and cry. Then the websites that I searched for today's webinar is AmericanPregnancy.org. And they had a little clip in there that said, well, what causes colic? And the first line of that was, well, we don't really know what causes colic. And so I'm going to jump off of that one because there is some truth to that. Baby's crying, and so we make assumptions. We may even have a grandmother-in-law or something who was trying to help out, but may have suggested that we switch to formula or switch formulas, or maybe we need to add rice cereal to the milk, or so, right? All of these things are geared towards baby's digestion. Maybe baby's allergic to mom's milk. Maybe baby's allergic to some other protein. Maybe they just need more food in their tummy. And there the rice cereal comes in. Well, I'm going to dispel all of those as a choice that a mom should make early in the beginning, because I don't believe that those are part of it. And there's a growing body of evidence that shows that chiropractic care, babies cry less when they receive chiropractic care. Now, we still can't identify exactly what it is that so-called caused the colic, but we do know that there are some studies showing, some placebo-controlled studies, that show that when babies have chiropractic care, that they cry less. So somewhere along the line, the problem is being solved. And so baby is crying less, baby is comfortable. Let's say baby is happy and able to go through life's processes. So as we're going to talk about one area, when babies are crying, we make the assumption that it's digestion. But what if it's something else? And something else that we can identify is that we know that these days, with almost approaching 30% cesarean section rate for moms, that maybe 3 out of 10 of babies are having a less than typical, a less than natural birth. And so there are the opportunities there that there have been interventions and that have happened, and specifically with a C-section, many times the doctor has to try to reach in to deliver baby. And when they are reaching in to deliver baby, there are certain forces that are necessary. The one place that usually the doctor can get a hold of is the baby's head and neck to pull baby from mother in a cesarean section. And so there is the opportunity with a cesarean section for trauma that's happening to these delicate structures in the upper neck. Even in a vaginal birth, that many times if mom has received some sort of pain blocking mechanism, then many of them don't allow her legs to move. So then mom has to be in a bed, usually on her back. And so then we can't use gravity, and pushing is a little less effective depending upon where the epidural has worn off or not. But then there is more pulling. So imagine that mom is on her back and delivering baby. Then more pulling is necessary by the doctor to pull and so-called deliver the head and then deliver the shoulder. And so more pulling again is created and placed on these upper neck structures. And those little delicate muscles, those little fibers and ligaments and tendons, they can get sprained, or they can get injured, or they can get pulled just enough. And there are enough studies showing that indeed in newborns this phenomenon does exist, that babies do have, for lack of a better term right now, we use the term subluxation in chiropractic. I'm also going to use the term spraining of these little structures in the upper neck. And so that can lend itself to a baby that may have some distress. They may feel the tightness. Same way if we as adults fall asleep on the arm of the couch, or we fall asleep in a funny position in a chair and we wake up and our neck feels stiff. Similarly, babies that have some birth interventions where there is the opportunity for spraining, they may have a distress that's happening here, and that's the only way they can communicate their discomfort is by crying. The other possibility is that indeed baby may have that subluxation and may have that spraining, but they aren't really feeling a clinical level of spraining. But what can happen too is these areas are so rich in nerves, not only nerves that travel through the spinal cord, but these days we know so much about cranial nerves that travel just out from the cranium. They don't even enter the spine, but they travel out from the cranium, but they travel really near the structures of the upper neck and the head. And so they're traveling really close to these muscles and ligaments that are holding the neck and the head. And so there are opportunities for those cranial nerves to also get disturbed a bit in the communication that's happening from the brain through the cranial nerves out into the body. One of those big ones is called vagus nerve, V-A-G-U-S, different from Las Vegas. But vagus nerve, that one has so many fibers that go into the digestive tract area, and it also goes into the heart and lung area. There is also control that's happening in the throat and head and neck area from vagus nerve. And then also plenty of vagus nerve fibers are actually starting or gathering their information from the body, from the digestive area, and then bringing that information up to the brain. those fibers go up towards the brain, and maybe as much as 80% of the fibers of that vagus nerve are gathering information from the body and then bringing it up into the brain. So if that nerve gets disturbed somewhere here, then there isn't really good communication. And we hear the term gut-brain connection, and I like to rename that gut-brain-gut connection, brain-gut-brain connection, because it starts out with the brain. The brain is that air traffic control, right? The brain is the one coordinating and calculating and gathering a lot of information and coordinating. So there is the possibility that there's spraining that happens in the neck of the little ones, interference of the nerves that are passing nearby and through these areas, and then decreasing the communication that can happen between the body and the brain. And all this is happening in little ones that are just weeks old. Colic is typically happening sometimes in the 2-week-old, but more often in the 6 to 8 week old. And that seems to be the time when colic symptoms seem to be the greatest. And so we're 6 to 8 weeks out from birth. So we may not be remembering how much trauma there may be at birth. There may even be a misunderstanding about how much trauma there is. You know, for many years, we thought that, well, a C-section birth is probably easier on baby because they don't have to travel down the birth canal. And that may not be true. Actually, C-section birth may be more difficult, may be harder on the baby. The forces, the trauma, the pulling, the way that it's different from a vaginal birth. And so that may be harder on the baby to have a C-section birth than it is to have a vaginal birth. But these are some of the mechanisms that we believe. So if indeed that chiropractic care is shown to decrease the amount of crying that babies do, then it's possible that as we are doing these gentle spinal adjustments, and many times when I do a spinal adjustment on a baby, I'm using my pinkies and I am just holding a pressure, kind of like if you would go to the store and you're going to pick an avocado and you're going to just test that avocado to see if it's ripe, then that's the amount of pressure that is typically used with an infant adjustment. It's just a gentle pressure, same like testing an avocado or a tomato for how ripe it is. And so that's the amount of pressure that we're using. So it's super gentle. And then maybe what we're doing, many times what I do is I use just a hold. It's a pressure and a hold. And then what I watch baby do is in response to my hold, which stays the same with my little pinky finger, then baby begins to move, and it's almost like they go, oh, they stretch. And many times right at that moment, kind of a neurologic sign is they'll yawn, right? It's an opening. They also may take a little breath. Many times they'll take a breath that sounds like like a large exhale, like, oh, thank goodness, something's gone. Like as adults, sometimes we'll find ourselves having those little breaths, and many times they're right when just something gets released or something is off the plate that our brain doesn't have to handle anymore. And so it's that gentle pressure that helps the body restore more normal function between the skull and that first vertebrae and the second vertebrae and all those tendons and ligaments and muscles that are attaching the whole complex there. And that helps that little system to get back to normal. And then there's better communication from the brain to the body and the body to the brain. And then there's more normal mechanisms of movement that can happen. Especially, we know mechanism of movement, we can sometimes tell that because if babies are getting to the point where they're ready for tummy time and they get fussy after 2 seconds of being on their tummy, that means that they're not even really able to comfortably hold their head up while they're on their tummy. So that's a good indicator for moms and dads that there's some kind of difficulty happening here, some straining, some altering in the function, because at the points where babies get to work on tummy time, which tends to happen at that 8-week mark, that 10-week, 12-week mark, where babies should be getting pretty comfortable for 30 seconds or so, holding their head in the tummy position. And that's a fairly conservative number. And so if baby is not that comfortable, then we know that there may be some opportunity. So how do we know? How do I know as a chiropractor what children I can help and what areas they may need to move on to another specialist? So one of the ways that we use in our office is a very sophisticated but easy way of testing. So we use something called a skin temperature, so a thermography. We use a device that doesn't even have to touch the skin, but it measures the skin temperature. And most importantly, we take 2 measurements called atlas fossa right up at the top in the soft place underneath the ear. So we get a temperature measurement on both sides there. And many times we'll get a few points in the spine as well of those temperature measurements. So we use this high technology but easy to do on the kids, this skin temperature measurement. And then the second one we'll do is something called a heart rate variability. So heart rate variability is done just by placing a little clip on the ear, and it measures the variability of the heart rate of the infant. And it's so easy. It's a 3-minute measurement. I did one on a baby today in the office that was 4 days old. He was born on Thursday, and he already had his first heart rate variability measurement today. To find out, heart rate variability can measure that fight or flight response. It measures that stress response. It measures how far in fight or flight our system is. And so we get, with that heart rate variability, we get a good number that says how much in fight or flight that little nervous system is. And otherwise we may not know. And then as time goes on, we can watch that measurement go from a high fight or flight response down to a low neutral, not a fight or flight response, right? Where that nervous system is in balance between the fight or flight mechanism and the resting mechanism. We get into that neutral area, which is just where we want to be. And in talking about fight or flight, so you may be asking, well, why are we measuring for fight or flight? Well, fight or flight is a real neurologic, it's a real response that our body has that has benefits. But the drawbacks are when we are in full fight or flight, there are certain things that get subdued or subverted. So that fight or flight response is meant for protection. But what gets lowered in a fight or flight response, 2 big things that get lowered in that fight or flight response are digestion and immune function. So imagine fight or flight response is kind of like running from the bear in the woods, right? Or escaping some kind of danger. When we are escaping some kind of danger, what's important is muscular activity. It's blood vessels out to the extremities, out to the muscles, get those muscles ready to fight or run. Well, if that's important, then what's not important? Well, what's not important is digesting our food. So as the little baby is in fight or flight, their digestion may be slowed. So what happens with slow digestion? In slow digestion, instead of the milk, mother's milk, being digested quickly and efficiently, maybe it can sit around in the tummy for a little bit longer. And what happens to something that sits around in a warm environment? It starts to ferment. And what do we get with something that starts to ferment? We get gas. And so that's where there's the link between fight or flight response, slow digestion, and then inefficient digestion that causes distress and gas. And then the second thing that can come in after a while is immune function. So when we are in fight or flight, and this, we're talking about little babies and colic, but this is true for adults as well. If we are in fight or flight, then our immune system, guess what? The white blood cells aren't the major important factor right there. Remember, it's running from the danger. So the immune system gets suppressed also. So what happens when little baby or even adult is exposed to a bacteria or a virus or so on that is allowed to grow just a little bit, then the immune system of the baby, now being on back burner because fight or flight is on the front, now it takes baby a longer time to get over that immune challenge. So that's the reason why we use that heart rate variability measurement, because if we know fight or flight, we know where digestion and immune function are. And that's super helpful because all we have to do is help the baby with this gentle adjustment, watch as the fight or flight decreases, and then we know immune function and digestion come back up to primary job, and then digestion can be efficient and immune function can be efficient and right on target. These tests that we do are so easy. The infants, it's super easy to put the ear clip on and to run the skin temperature. Toddlers, we make it fun. They have a great time. They get to watch the computer. They get to operate. We get to make them feel part of the whole process. And so this scanning technology that we have is just great information, and it's so easy, and we make it so fun for the kids. So we get a measurement where we know where the skin temperature is off, right? Where the brain is not talking well to the blood vessels, and where blood vessels are dilated on one side and constricted on another side. Then we get a hot measurement on one side and a cool measurement on the opposite side. So that's our skin temperature. And then the ear clip with the heart rate variability. So all of these measurements allow us to know whether or not chiropractic care is the right thing at the right time for this infant, for this youngster. Specifically, we're talking about colic today. Because we know as we do those gentle spinal adjustments that episodes of crying decrease in the little ones. And truly that's the definition of colic, is really all about how much a baby is crying and whether or not they can stop, or we can clean the diaper, feed them, rock them, get them to sleep, and have their system be able to calm down and settle down. So, hey, this has been fun. I love these topics. I'm always investigating and learning so I can bring the best. If there is anything that you would like to hear about in the future, please feel free to leave it in the comments below. Share this video if you know a mom who's struggling. I'm a mom, and there's my greatest purpose in life is to help families and to help families live a more wonderful life. And certainly when babies are happy, mom's happy, dad's happy, the whole family is allowed to be a more beautiful family unit if everybody is on track with their health and allowed to express a little more health. So if there is anything you'd ever like to hear about, post it in the comments below. Share this with a mom friend if you have a mom friend who's struggling. And we look forward to hearing from you in the future. I love and appreciate you all. Have a beautiful day.